Hello, I'm Dr. Leslie Douglas, and I am the Laboratory Director here at DNA ConneXions. Today I'm going to discuss the comprehensive oral panel, everything from proper sample collection, filling out the paperwork, returning your sample to the laboratory, and how to understand and best utilize the reported results. The comprehensive oral panel is a very large PCR-based panel that is composed of 88 organisms, primarily bacteria, but inclusive of bacteria, viruses, parasites, and fungi. We utilize PCR to target the DNA of the causative organisms themselves. The results are based on presence or absence of the organism, as well as being related to the overall characteristics of the organisms detected. These 88 organisms have been carefully selected based on their presence in the oral cavity, as well as their relationship to chronic conditions and symptomology that are both on the local and systemic levels. 98% of the panel is based on the species level of detection, which is really important because it allows for very targeted and very specific therapies to very specific species. The oral panel is typically utilized for samples obtained from the oral cavity. Typical sample types are teeth, extracted oral implants, oral and cavitational blood, paper points, superfloss, which can be both used in a site-specific or full mouth survey manner, tissue, bone, etc. Other sample types, both oral and non-orally based, can be discussed with the laboratory before submission. DNA ConneXions will send the various collection kits to practitioners on request at no charge. We will bill when a sample is received and accepted by the laboratory. All of our collection kits include everything needed for sample collection, packaging, and prepaid UPS return shipping. Follow the preparation and collection instructions carefully and fill out the paperwork. The included plasticware with each of our kits has a 3-month expiration date as it is flushed with nitrogen gas to help preserve the DNA during return shipping. This is not a hard and fast expiration date, rather it is based on the laws of gas dispersion. DNA ConneXions can replace the expired plasticware on request. Please do not add anything to the plasticware. This includes water, formalin, saline, etc. The only thing that you should be sending us is the sample that you want tested. The main difference between our collection kits is the size of the included plasticware. What you're looking at here is a superfloss collection kit. It comes with a 50 ml plastic tube. We don't want you putting extracted number 31 into a really teeny tiny 1.5 ml that comes with the blood kit. Again, collection kits are provided at no charge, and replacement tubes are provided at no charge as well. To combine or not combine samples. I get this question a lot from practitioners, and they want to know what other practitioners do. Each sample tested is a separate panel and a separate fee. Samples can be combined either in the dental office or in the laboratory. Once a sample is combined, it cannot be separated. So what is typically done? Some practitioners test each sample separately. For cavitations 1, 16, 17, 32, we will get 4 tubes, it's 4 tests, it's 4 panels, it's 4 fees. Some practitioners do all their testing by quadrant, and some practitioners use the kitchen sink method. So all 4 cavitations into 1 tube, or they send us cavitations separately and ask us to combine them here in the laboratory. Either way is acceptable. You just need to be really clear on how you want the samples tested. If we have any question as to what you want, we will call to clarify. If you want something special, just ask. We're here for you and your patients to get you the information that you need. Packaging and shipping. Read the packaging instructions carefully. If you are unable to ship the sample immediately, then freeze until you are able to package and ship via UPS. Please only return your samples to the laboratory on Monday, Tuesday, or Wednesday because we don't want the samples sitting at UPS over the weekend. The prepaid UPS label included with each kit does not include scheduled pickups. You can give the package sample to your usual carrier or find a UPS drop-off location that is convenient. The report. The report includes information that is relevant to each sample, including the name of the patient, the date of birth, the prescribing physician, and a unique test ID. There are dates associated with the particular sample type, like the collection date all the way through the test report date. We delineate the sample type according to the paperwork submitted with each sample. Again, if we have any question, we will call to clarify. The bar graph of the 88 organisms included in the panel, we report on the organisms that were detected in the sample provided. There are 3 risk factors associated with each organism that causes the length and the color of the bars for the overall risk factor of the presence of the organism. The first risk factor is the pathogen risk factor. This describes and takes into account the overall characteristics of the organism detected. Is the organism dangerous? Should it be in the oral cavity? Should it not? Does it have inherent antimicrobial resistance, or does it harbor or produce inherent toxins? All based on the characteristics of the organism detected. The second risk factor is the measured risk factor. That is the amount of the organism that we detected in the sample provided. Finally, the total risk factor is a combination of the pathogen and measured risk factors together. What organism we detected, how bad that organism is, and how much of it was detected in the sample provided. Every organism detected on the oral panel report, we provide a general description of that organism, generalized symptoms of an infection of that organism, and CDC recommended treatment options. It is up to the practitioner and the patient to relate the detected organisms to overall symptomology, the presence of localized infections, and systemic conditions and chronic conditions present in this patient. Thank you so much for listening. This is Dr. Leslie Douglas, Laboratory Director of DNA ConneXions.